Hello. Have you ever stopped to think about the impact that your daily food choices have on your health? Often, we are so busy with our routine that we forget something essential: taking care of our bodies and preventing it from developing chronic diseases. Diabetes, hypertension, and many other conditions that seem so distant can be shaped right now by what you put on your plate. Did you know that small adjustments to your diet can transform your life and your future? We're not talking about following miracle diets or cutting out foods that you love, but about better understanding how what we eat can prevent or even control these conditions. Let's explore together how you can use food as your ally in the search for a healthier life. Imagine the following scenario. You are aging with energy, without pain or constant worries about medications or frequent doctor's appointments. Does it sound too good to be true? Well, I assure you that it is possible. And it all starts with valuable and practical information about how nutrition can revolutionize your health. Let's explore this topic calmly and in depth, like a conversation between friends, debunking myths and highlighting scientific facts that can change the way you view food. The relationship between diet and chronic diseases has been widely studied by science. Here are some of the main benefits of a balanced diet: regulating glucose levels. Foods rich in fiber such as oats, legumes, and vegetables help prevent spikes in blood sugar. Studies published in the American Journal of Clinical Nutrition showed that consuming soluble fiber reduces the glycemic response in individuals with type 2 diabetes. Reducing blood pressure. Consuming potassium in fruits such as bananas and avocados combats the effects of sodium. According to the American Heart Association, diets rich in potassium can reduce hypertension by up to 10%. Controlling body weight. Balanced diets reduce the chance of obesity, one of the main risk factors for chronic diseases. Research from the Journal of Obesity indicates that regular consumption of whole foods is associated with lower body mass index (BMI). Improving cardiovascular health. Good fats, found in olive oil and fish, help prevent heart attacks. The New England Journal of Medicine reported that Mediterranean diets rich in extra virgin olive oil reduced major cardiovascular events by 30%. Reduced systemic inflammation. Foods such as ginger and turmeric have anti-inflammatory properties. Research from the Journal of Nutrition suggests that compounds such as curcumin, found in turmeric, help regulate inflammatory cytokines. Strengthened immune system. Vitamins and antioxidants found in citrus fruits and dark leafy vegetables protect against infections. Studies from the Nutritional Immunology Journal highlight that vitamin C can reduce the duration of common colds by up to 20%. Increased energy. Complex carbohydrates provide sustained energy throughout the day. Research published in the Journal of Sports Sciences indicates that whole grain carbohydrates improve physical and mental performance. Gut health. Fermented foods such as kefir and yogurt balance the intestinal flora. The Nature Microbiology study demonstrated that a balanced intestinal microbiota is linked to the prevention of metabolic diseases. Kidney protection. Diets low in sodium and high in potassium reduce the risk of kidney disease. According to the National Kidney Foundation, this also helps slow the progression of chronic kidney disease. Lowering bad cholesterol, LDL, nuts, seeds, and soluble fiber help control cholesterol. Studies in the Journal of Lipid Research confirm that diets with nuts reduce LDL by up to 15%. Mental health. Diets rich in omega-3s, found in fatty fish, promote well-being and reduce anxiety. Research published in Translational Psychiatry shows that regular consumption of omega-3s is associated with a 20% reduction in symptoms of depression. Cancer prevention. Bioactive substances in cruciferous vegetables help protect cells from damage. According to the Journal of Cancer Prevention, compounds such as sulforaphane have potent anti-cancer properties. Improved sleep quality. Magnesium in foods such as spinach and almonds promotes relaxation. Studies from Sleep Journal indicate that adequate magnesium intake improves sleep quality and duration in adults. Reduced risk of stroke. A balanced diet regulates cerebral blood flow. Stroke Journal has shown that diets rich in fruits and vegetables reduce the risk of stroke by up to 25%. Controlling triglycerides. Healthy fats help prevent the formation of fatty plaques. A study published in the American Journal of Cardiology highlights that consuming fish oil reduces triglycerides by up to 30%. Maintaining bone health. Calcium and vitamin D are crucial for strong bones. Studies in the Journal of Bone and Mineral Research associate adequate consumption of these nutrients with a reduction in fractures in the elderly. Preventing autoimmune diseases. A balanced diet can prevent inflammatory triggers. Research in autoimmune reviews indicates that an anti-inflammatory diet reduces the progression of autoimmune diseases. Increasing longevity. Antioxidant foods slow down cellular aging. Studies in aging research reviews highlight that diets rich in fruits and vegetables extend life expectancy. Improving cognitive performance. Nutrients such as choline, found in eggs, help with memory. Research in the Journal of Clinical Nutrition shows that diets rich in choline are associated with improved memory retention and learning ability in adults. Protection against insulin resistance. Foods rich in fiber and with a low glycemic index help improve insulin sensitivity. Studies published in Diabetes Care reveal that diets with whole grains and vegetables can reduce the risk of developing type 2 diabetes by up to 40%. Reduction in joint pain. Foods rich in omega-3, such as salmon and flax seeds, have anti-inflammatory properties that help relieve conditions such as arthritis. According to Arthritis Research and Therapy, diets rich in omega-3 are associated with a significant reduction in joint pain. Improvement in blood circulation. Foods rich in flavonoids, such as cocoa and berries, promote the dilation of blood vessels. Research from the Circulation Journal indicates that consumption of dark cocoa improves blood flow by up to 15%. Reduction in the risk of childhood obesity. Introducing healthy foods in childhood can help prevent obesity. Studies from the Pediatrics Journal show that children who regularly consume fruits and vegetables are less likely to become overweight in adolescence. Improved respiratory health. Antioxidant foods, such as citrus fruits and carrots, help protect the lungs. Research from the European Respiratory Journal suggests that beta-carotene intake may reduce the incidence of chronic respiratory diseases. Promotes hormonal balance. Foods rich in essential fatty acids, such as nuts and seeds, help regulate hormones. According to the Endocrine Journal, adequate consumption of good fats can help balance hormones, such as estrogen and testosterone. In addition to preventing diseases, a balanced diet also contributes to organic health, optimizing the functioning of the body's systems. Improved digestion. A diet rich in fiber, found in whole grains and fruits, promotes healthy intestinal transit. Studies in the Gut Journal indicate that adequate fiber consumption reduces the risk of constipation by 30%. Natural liver detoxification. Vegetables such as broccoli and kale contain compounds that help the liver eliminate toxins. Research from the Journal of Hepatology shows that consumption of cruciferous vegetables is associated with a reduction in markers of liver inflammation. Strengthening the heart. Diets rich in unsaturated fats, such as those found in avocados and olive oil, help maintain healthy blood vessels. Diabetes and hypertension are conditions that affect several systems of the human body, leading to serious physical and organic problems. Cardiovascular complications. Diabetes and hypertension increase the risk of atherosclerosis, a condition in which the arteries harden and build up fatty plaques. This condition can lead to heart attack, stroke, and heart failure. Research from the Cardiology Journal reveals that people with high blood pressure have a 60% higher risk of developing heart disease. Kidney damage, nephropathy, high blood glucose levels, and high blood pressure put a strain on the kidneys, leading to diabetic nephropathy, or chronic kidney failure. The National Kidney Foundation estimates that 40% of patients with type 2 diabetes will develop serious kidney problems. Diabetic retinopathy. Hyperglycemia damages the blood vessels in the retina, resulting in gradual vision loss. According to the Journal of Ophthalmology, diabetes is the leading cause of blindness in adults between the ages of 20 and 74. Peripheral neuropathy. High glucose levels affect peripheral nerves, causing pain, tingling, and loss of sensation. Studies in the Pain Medicine Journal indicate that up to 50% of diabetics experience symptoms of neuropathy. Brain diseases. Uncontrolled high blood pressure can cause microbleeds and cognitive impairment, while diabetes increases the risk of vascular dementia. Research in the Neurology Journal links diabetes to a 30% increased risk of Alzheimer's. We've reached the end of this journey, and I hope you're leaving with a new perspective on the impact of food on your life. The science is clear. What we choose to put on our plate today can define our quality of life in the future. From preventing chronic diseases like diabetes and hypertension to promoting overall well-being, a balanced diet is one of the most solid pillars for a long and healthy life. It's important to remember that it's not about radical diets or extreme sacrifices, but about conscious choices made step by step. Small changes such as including more fiber, reducing the consumption of ultra-processed foods, or increasing the intake of good fats can bring immense benefits. Whether it's preventing disease, controlling symptoms, or promoting active aging, food plays a central role. And the most incredible thing is that this power is within your reach every day, with every meal. So this is the final invitation. Look at your diet as an investment in your health and your future. Start today with small decisions and transform your life from the inside out. After all, as we have seen, the secret to living longer and better may be closer than you think. In the dish you choose to prepare each day. Health starts in the kitchen, and the next step is yours.